Welcome everyone to the Infection Prevention Strategy or TIPS Masterclass webinar, Best Practices to Service Facilities for COVID-19. The highly transmittable nature of this novel virus and the exposure risk associated with it are evolving daily. Understanding the most recent updates on COVID-19 is essential as we implement recommended processes and procedures from government and regional health authorities. These recommendations will provide maximum efficacy against the virus while maintaining a safe environment for our staff, patients, and customers. Participant lines have been muted. Unfortunately, continuing ed or CE credits are not available for this event due to the limited time to obtain approval in this evolving COVID-19 situation. We will be hosting another webinar May 5th. See the Master Series.events for more details. Please note this webinar on May 5th will be offered in French only. My name is Dr. Katie Morales. I'm a professor of nursing at Berry College in Rome, Georgia. By participating in this webinar, you acknowledge that the statements and information provided is for general guidance purposes only. The coronavirus situation is evolving and dynamic. You are advised to contact your local government and regional health authorities for specific instruction on all the topics mentioned in this webinar. This webinar is not to replace the guidance and direction of your local government and health authorities. This webinar series is hosted by the Infection Prevention Strategy, or TIPS. TIPS is a not-for-profit organization existing to advance innovations, ideas, and processes which make a difference in global health. TIPS extends to over 30 countries and is the key strategic partner for many notable organizations, initiatives, and events. In the past few years, TIPS has contributed millions of dollars worth of scientific impact through various programs. You can learn about their successes in several ways: on their open access journal, infectioncontrol.tips, at conferences such as the HITS conference, through masterclass events such as this one, or on their podcast series. We are proud to have the following 4 sponsors for this webinar. First, we have ISSA Canada. Next, we have J&A Cleaning Solutions. We also have Swish groups of companies, experts in complete cleaning solutions. And finally, we have Cursia Medical, manufacturers of NADCC, fast dissolving effervescence tablets. The learning objectives for today are posted on the screen for your convenience. This presentation will last approximately 50 minutes, followed by 10 minutes for questions and answers. You will type your questions in the webinar panel labeled Q&A, and we'll follow up after the webinar to address any questions we're not able to answer during the webinar. Without further delay, let me introduce today's speakers. First, Mr. John LaRochelle. Mr. LaRochelle is the founder and CEO of Environmental Infection Prevention Incorporated and is president of Lighthouse Healthcare Partners. He has spent over 30 years with Sodexo. He's responsible for program development and technical support of 600 healthcare locations in the U.S. His expertise in the environment, infection prevention, and ability to establish productive collaboration with key stakeholders to impact change. He is also an advisory board member of infectioncontrol.tips. Next, Patty Olinger is the Executive Director of the Global Biorisk Advisory Council, or GBAC, a division of ISSA. GBAC is recognized as a leader in training, education, and certification in forensic restoration, biorisk management, decontamination, and infection contamination control disciplines. Prior to joining GBAC ISSA, Patty was the Assistant Vice President in the Office of Research Administration and Executive Director of the Environmental Health and Safety Office at Emory University. Patty is a registered biosafety professional, a certified forensic operator, a certified bioforensic restoration specialist. She has a Bachelor of Science in Biochemistry and a Master of Law with a focus on international global health. Patty has a true passion in global health biorisk preparedness, response, and recovery. Today's webinar includes audience polling questions. Your answers are anonymous. The first one is designed to help us get to know today's large audience better. Please tell us, what is your role? And here are the responses from our audience. So you can see our demographic there, mostly cleaning, disinfection, owner or property manager, and sales and marketing. Very good. All right, we have one more question. Please tell us about your work setting, your facility focus. Okay, thank you. That's very helpful. All right, without further delay, I'll turn it over to John.
Okay. Well, thank you, everyone. We really appreciate you participating today. This is a phenomenal group, probably one of the largest groups that we've ever had on one of these type of broadcasts. We have a tremendous amount of information to go over. Again, my name is John LaRochelle. We're going to try to go through a lot of this very quickly. But we'll try to also stay on beyond the 1 hour time to kind of talk through many of the questions that you may have. So here is the presentation outline today, and without further ado, we're just going to get right into this. So with COVID-19, everybody knows by now the highly contagious nature of this organism, and then it spreads dramatically quickly from person to person through people coughing and sneezing, as it can stay airborne up to 3 hours. And there's studies that show that it can stay active on a surface for up to 17 days. So anytime someone coughs or sneezes, if they're transmitting this organism and touch a surface, and then you touch that same surface, and then your nose, your mouth, your eyes, that's where transmission can occur. And we've seen in many cases a dramatic amount of community transmission, and we'll talk about that, where you go to the grocery store, gas station, just anywhere in public where you can pick up this organism. So let's talk about where we are today and where we're going. And to me, this is absolutely a war on pathogens. We're talking real people, real lives, and real impact. This is something that most of us have never seen in our lifetime, and we really need to change the way we're thinking of cleaning and disinfection. Because in a lot of ways, the way we clean has been the same way we've been doing this for 50 years. I started over 35 years ago as a housekeeper, cleaning colleges, cleaning hospitals. And a lot of the practices that we use today have not changed in that amount of time. So I'd like you to think what 9/11 did to us and think about how it changed the airline industry. We don't go to the airport and think of it the same way we did prior to 9/11. We have to take off our shoes. We wait in sometimes long lines, but that's acceptable. So I'd like you to think also now what COVID-19 is going to do for us as it related to cleaning and disinfection. We must change the way that we go about cleaning and disinfecting. And we're going to talk about some of those challenges, and then we'll talk about some of the solutions today as we go through this. So first, I'm going to go through some of the common failure points that we have in cleaning and disinfection today. I'll go through these fairly quickly, and then we'll get into the solution set. So if you're looking at the cleaning and disinfection world, we really need to look at the people, the process, and technology. And you've got to look at all the environmental surfaces, whether it's hand hygiene, surfaces, air, water, the devices you use. All those need to be considered when you're looking at strategies against organisms like COVID-19. This was a study done by Dr. John Boyce. It showed the amount of pathogens on a surface prior to cleaning, and then the amount of pathogens after cleaning. Now, you would think that the pathogen level would get better, but this really is the foundation of everything that we've done to really educate people that if you're not following the proper people, process, and technology related to cleaning and disinfection, you could very possibly make the problem worse. We also know pathogens live a dramatically long time on surfaces. A simple staph infection such as MRSA, 9 months on a surface. COVID-19, one of the easiest organisms to kill or to inactivate, can last up to 17 days. So we have to keep this into consideration as we're looking at cleaning. We also know there's something called dry surface biofilm. Now we know the wet biofilm has been around for a long time, but the education around dry surface biofilm has just emerged in the last few years. And it's simply a bunch of unrelated pathogens that work together and create a place to live that protects them, the pathogens, against various disinfectants such as bleach, some quaternary ammoniums. So we really have to look at this in our strategies at cleaning and disinfection. We also know in this study done by Dr. John Boyce that certain quaternary ammonium disinfectants will bind to mops and cloths. So when you submerge your mops and cloths into a solution of quaternary disinfection, the quaternary ammonium can attach to those mops and cloths and basically leave you nothing left in your bucket to actually disinfect the surfaces. As you see on this graph, within 30 minutes, the disinfectant solution had no active disinfection left. It was actually attached to the cloth. That's called quat binding. We also know cross-contamination is a challenge. In a University of Arizona study, they showed that laundering mops and cloths, reusing them over time and time again, can leave a dramatic amount of pathogens still active even after laundering. Now, it is a catch-22 because there are a lot of commercial facilities that can launder microfiber effectively and eliminate that biological burden. But as I'll show you later, it is a catch-22. Perfectly new microfiber is one of the best mechanical tools that you have. You can actually remove about 78% of the C. diff pathogens off a surface with a brand new microfiber. But once you launder it, as the picture shows on the right, a microfiber is thinner than a strand of your hair. That plastic will essentially melt and become ineffective and will only be about 12% effective versus 78%. And one of the last challenges that we face is floor contamination. I can tell you as a former housekeeper and as a housekeeping manager, we've always not looked at floors as a big value or as a risk. But in this study done by Dr. Curtis Donsky and others, they inoculated floors and studied where that organism went over time. Within 2 days, 62% of the patients had the same pathogen from the floor on them and 62% of the surfaces. Now, I know a lot of you are not in a healthcare setting, but it really doesn't matter. The science of this is still applicable to any building, any environment that you're in. You sit in a room on a sunny day and you see those dust particles floating through the air. That's exactly what's happening. One of the reasons. Those dust particles are contacting the floor, grabbing those organisms, and they're recirculating through the air. And these organisms will travel from the room that you're in throughout your building. So let's talk about cleaning and disinfecting in the COVID world, and to help us better understand how we move forward now that we've looked at some of those challenges. This absolutely impacts everyone. It does not matter if you're in a school, a senior care facility, a hospital, an office building, or your own home. Or maybe you're managing a fleet of operations, whether it's vehicles, buses, ambulances, different transportation vehicles. This absolutely impacts everyone. So let's first talk about how to be safe, personal protective equipment. And we're going to kind of go over a lot of this quick, but there are a lot of resources that you can find, and we'll talk about those in a minute. So the first question is, when should you use PPE? You should absolutely use it when you're directly or indirectly exposed to body substances and fluids, contaminated equipment, whether it's currently in the room that a COVID patient, or maybe it was someone in an office building that was now diagnosed with COVID-19 and you have to go in and clean it. So, or the equipment came out of one of those spaces. So basically any contaminated environmental surfaces have to be considered. Contaminated air. As I talked about, you have dust. This is an airborne pathogen that can stay suspended in the air for a significant amount of time. And contaminated waste in linen. Handling this absolutely should be carefully done, and that's when you need your proper PPE. So what are some examples of and what is required for PPE? Protective clothing. That could be a tie-back suit, it could be a gown, or any other type of barrier that you put on to protect your clothing and yourself from this pathogen. A mask or respirator. There's many different types, and we'll talk a little bit more about that in a minute. And also goggles or face shield. If you're dealing with something that's going to splash or spray occur, you absolutely should be using some sort of goggles, face shield, or both. And then lastly, gloves. So those are the basic PPEs, and it also will depend what type of area you're looking at. So this is a simple guide that I recommend that you download. You can find them, these guides, on both the Canadian and the US CDC. This one's from the United States CDC, and it's on donning. So donning is a simple term of putting on your personal protective equipment. So you first put on your protective clothing, then you put on your mask, making sure that it's fully sealed. If it's an N95 or a KN95, you must make sure that it's fully sealed to your face. Unfortunately, if you have a beard or a lot of facial hair, it's not going to get properly sealed. And if you're in a medical facility, you really should be required to be fit tested to make sure it's properly sealed. Then you put on your goggles, face shield, or both, and then your gloves. So that is the donning step. And again, download this chart from CDC. World Health Organization has them. They're really great guidelines that you can post throughout your facility. So let's talk about doffing. Doffing is the process of removing your PPE. Some facilities will have you single glove, others will have you double glove. But understanding what your requirements are at your facility, your situation, is critical to understanding. But the first step is you're going to be removing your gloves. You need to very carefully peel back so you're actually turning that glove inside out as you're pulling it off, being careful not to recontaminate your hands. So you pull them off one at a time, you place them in the waste receptacle, and then if you think there's a threat of anything that you've got on your hands, a lot of facilities use a hand sanitizer step at this process just to make sure that their hands are safe as they go through the rest of the doffing process. After your gloves are removed, remove your goggles or face shield, then your protective clothing. And each time, being very careful. When you're removing your goggles and face shield, make sure you remove it from the back part that's around your face and try not to touch things that might have been contaminated from direct splashing or spraying. Then you remove your protective clothing, pulling it inside out, making sure you do this very gently and very carefully. Many times we recommend a mirror to be in place so you can actually see yourself doing it, so you know where the ties are, you're not recontaminating yourself. You're pulling it out, inside out, and gently placing it into the waste receptacle. Your mask should be taken off without touching the front of the mask. That's where the majority of the contamination is going to be. So you got to be very careful in that process. And then lastly, you must wash your hands. A full hand washing is the best. If not, alcohol hand sanitizer. And we'll talk about hand hygiene in a second. So what are the different types of masks and what do they do for you? The most common in most medical facilities and facilities that are actually cleaning active COVID either patients or people that have been there, whether it be in a house, whether it be in a nursing home or an office. If there's been someone in there, that's been active, then you really should be getting an N95 or a KN95 mask, because those type of masks will both protect you and others from the organism. Surgical masks, patient masks, the ones that you see down below, are great for protecting others from you, but they're really not going to protect you as much as the N95 from someone that has it. So they're better than nothing, especially the cloth or homemade masks. We're seeing a lot of guidelines in our communities. You must wear some type of mask. So having anything is better than nothing. But prior to going and selecting what type of mask is best for your environment, you really should conduct a risk assessment and understand what type of environment that you're in and what type of environment you're cleaning. So the CDC, the US CDC, talked about when is it safe to enter a room without a mask. So quite simply, there's the guideline on how many air exchanges they are. You know, work with your facilities team to understand what the airflow and the air exchanges are in your area. But bottom line, when in doubt, if you can't validate it, wear a mask. It's better to be safe than sorry and not put yourself or your teams at risk. So this is an interesting study that was done by MIT showing the power of a sneeze. And some of you may have seen it. It's kind of an animated, but the yellow on the left is actually a picture of someone sneezing. It can, the sneeze, the organisms as you sneeze can attach to dust and particulates in the air and remain suspended in the air for quite a long time. And it depends on a lot of things. So, and it can travel on these particles for up to 27 feet. So understand that air currents, air movement, people coughing, sneezing can have dramatic, long-reaching implications in your facility, and you need to be prepared and keep your team safe. So let's next talk about hand hygiene. Obviously, hand hygiene is one of the most important, if not the most important, aspect to keeping ourselves safe. But unfortunately, it's something that's not done enough, and it's not done properly. So this is actually a great video or a picture that I saw up in a Canadian hospital where they had this picture, 953 hands have touched this door. And right next to it was a hand hygiene dispenser. But this is not just a hospital problem. When you go to a grocery store and you're grabbing that cart, when you're going to the gas station and you're grabbing that gas nozzle or any other high-touch item as you're going through your life, understand that these are modes of transmission to you and to other people. So let's talk about hand hygiene, and there are basically two types. You have hand washing, and then you have hand sanitizers. But both of them fundamentally follow the same process. Now, this is a great tool and posters that you can download from the World Health Organization. I highly recommend that. So, but understand the process. If we look at hand washing on the left, there's an absolute process. You turn on the water, you wet your hands, you get the soap in there and you lathering it up, but you need to get all aspects of your hands. You need to get not only the palms of your hands, but between your fingers, the backs of your hands, your fingertips, your thumbs, your wrists. And when you do all that, it should take you about 20 seconds. You know, the rule of thumb is singing happy birthday a couple times, but you really need to focus on all those areas. If you're not getting your thumbs or your fingertips, which typically is missed by over 50% of the people that do hand hygiene, how do you eat? How do you hold your cell phone? It's typically with your fingers and your thumbs. Make sure those are properly washed. After you rinse your hands, use a paper towel to turn the water back off. Use that piece of paper towel to reopen that door of that bathroom, because chances are someone may not have done it properly. And that's going to keep you safer. So Also, hand hygiene, hand sanitizer. As you're going about your daily life, if you can have some in your car, if you can have some at your workstation, these are great tools. This is a great tool to help keep you safe between actual full hand washing. And it's really the same process. You have to put enough in your hand to get your fingertips, to get between your fingers, the back of your hands, your thumbs, and get all aspects of your hands. One of the mistakes that are commonly made is people only get cover with hand sanitizers, the palm of their hands, maybe their backs, not enough for the tips of their hands or their thumbs. So make sure you use an appropriate enough hand sanitizer to get all those areas, and use, again, the 20, at least a 20-second process to go through. So let's now talk about cleaning and disinfection. And certainly the world of cleaning and disinfection, as we talked about, has changed dramatically. Look at the heroes of environmental infection prevention are the cleaners, the housekeepers, the custodians, the environmental services workers, whatever we want to call them. If these individuals don't do their jobs, then people are not going to be safe. And there cannot be enough emphasis placed on this group of heroes in today's environment. And we would like to absolutely see and recognize a lot more attention to them. These housekeepers are risking their lives. They're on the front line, and many times I've seen them not have appropriate PPE. And if they do have it, are they trained properly in it? They're really responsible for keeping the facility safe. And, I've worked in a lot of hospitals in my career, and I've had the top infectious disease doctor or the infection prevention nurse come up to me and say, or up to the housekeepers and tell them that their job is more important in a lot of ways from the healthcare professionals, the doctors and nurses, because if the housekeepers don't do their job, then everything's contaminated and everyone's at a higher risk. They're also some of the lowest paid people in the world. The average wage rate in the United States for a housekeeper is $11 to $12 an hour. We really need to put better emphasis on paying these people better and treating them with more respect and giving them the resources that they need, because they're absolutely overworked and not always given the proper amount of materials and equipment to work with. This is Dennis Dixon. He's an NYPD custodian, New York Police Department. He lost his life to COVID-19 on March 26th. Did he have enough PPE? Did he have enough of the proper equipment to do his job properly? I'm not sure. But I want to emphasize that this is real lives that we're dealing with, and it affects people every day. So let's start digging in a little more to cleaning and disinfection. So there are two distinct parts that a lot of people miss when it comes to cleaning and disinfection. First is cleaning. That's when you visibly remove the gross soils, the dirt, the body fluids. You need to properly do this prior to disinfecting. If you don't remove the gross soils and these organisms from the surface, it's not going to allow the disinfectant to do its job. So cleaning is simply removing the gross soils. And disinfection, in its simplest form, is helping to remove the pathogenic microorganisms, really to the point where they can't spread anymore. That's the job. We're trying to reduce them down to the point that they're not going to transmit to someone else. COVID-19, coronavirus, is a very easy organism to kill, but you have to wipe all the surfaces. You have to use an approved disinfectant, and we'll talk a little bit more about that. And here we are, disinfectants. Understand that if your product that you're using, whether it has the emerging viral pathogen claim, most of the participants on this call, we have from many countries represented, but in the US and Canada, they have a list of disinfectants that are approved or actually have the emergent viral pathogen claim. And those are the ones that they point you to utilize. Some of the key things to success when you're using disinfectants: you must meet the contact or dwell times that are required. So if it says that it needs to stay wet for 10 minutes, then that's how long it needs to stay wet on that surface to be effective. We want to make sure it's safe for staff, customers, and the surfaces. A lot of the products that we see in the industry may be very effective on organisms, but they destroy our equipment, such as bleach. So we need to look at things and make sure we not only keep our people safe, but things that aren't destroying our medical equipment, our school equipment, or computers, or anything that's actually in our industries. We need to follow the label requirements of the disinfectants. So for example, if you have a disinfectant that says that it needs to be applied with a spray application, then that's simply what you need to do. You cannot put that in a bucket and wipe it if it says it's for spray application. So look carefully at the label to what the disinfectant says it should be used for. You need to be able to use it on floors. We know from the Donsky and other studies that the floors are contaminated. The floors are causing these organisms to travel to different surfaces. So we must make sure we disinfect those floors on a regular basis. And lastly, biofilm. Look to see if your disinfectant has a biofilm claim. Those are the ones that are going to give you the best chance for success. So let's kind of go through the cleaning and disinfection process. This really applies to all facilities. We'll talk about how to customize this a little bit, but I'll kind of go through these steps, and certainly you need to adapt this to your specific environment. First and foremost, hand hygiene. You got to do hand hygiene, whether it's hand washing or hand sanitizing. Then you put on your PPE. When in doubt, err on the side of caution. And if you don't know for sure, put on a mask. Get on your gloves, your protective clothing, goggles if you have a risk of splash. And in the cleaning world, we do a lot of things that can cause splashing. So again, whether it's safety glasses, whether it's full goggles, there's a lot of options for you, or a full face mask. Be careful to remove linens and waste. These can generate aerosolized particles into the air if you're roughly shaking, whether it be bed linens, whether it be pulling trash out. Be very careful to remove these so they don't aerosolize. If you're high dusting, if you must high dust, damp high dust only. Do not dry dust, because that's going to just create particulates into the air. And then clean and disinfect all surfaces, remembering that this is a two-step process. Use single-use wipes with a disinfectant. It's far more effective, as we've talked about. Microfiber used once is more effective, and we don't want that cross-contamination. Use the single-use and then discard. And then we focus on all the high-touch surfaces. Ideally, you're wiping down all the surfaces, but the key ones are the door handles, the faucet handles, anything that someone in the space is going to touch, keyboards, mouse pads, desks, things of that nature. We want to use a single-use dry mop. You do not want to use room to room to room, because you're just going to be spreading things around. You're going to be aerosolizing things with the old style dry mops. The new single-use microfiber mops are far more effective, and we'll show those in a graph in a second. Single-use damp mop with the disinfectant. Again, you want to dry mop your floor to get the gross material off the floor, to get the dust, the sand, the dirt. And then you want to damp mop. It's absolutely a two-step process. If you refinish your floors, it's going to give you a better ability to have success and keep that finish. Disinfect your equipment, doff your PPE, and then carefully do your hand hygiene. We'll talk about enhanced disinfection after, but this does not replace regular cleaning, whether it's being fogging, UVC, These are great tools, but only after you clean and disinfect. So we have a lot of people on the calls that manage fleet operations, whether it be buses, whether it be trucks, whether it be emergency vehicles. And this is actually pulled from the CDC. You know, you want to really frequently clean those high-touch surfaces between drivers at the beginning and the end of each shift or each service. And again, you want to focus on all those high-touch surfaces to make sure that vehicle is safe for the next person coming in, and so you're not transmitting. So let's talk quickly about some of the high-risk areas. Look, this is something that we need to be aware of. Everyone is at risk in every type of facility. We know the organism stays active to up to 17 days. We know it stays airborne for a long time. So if you're vacuuming, consider, you know, we recommend a HEPA filter. And if you're in an active room, you know, you probably don't even want to be vacuuming whatsoever until you've had enough air exchanges and it's safe. Buffing and burnishing. If you have to do this, again, a HEPA filter process. But again, if you're in an active room, we do not recommend this. Linen removal, whether it be cubicle curtains, regular curtains, bedding, be very careful, you know, roll these up very carefully, place them in a linen bag, and then remove them very gently. Certainly, as we talked about, dusting and trash removal can also aerosolize things into the environment and create risk. So let's talk quickly about some of the best-in-class innovations. So single-use microfiber that I talked about. The advantages is there's no cross-contamination. It's far more effective at removing pathogens. You use less water, and believe it or not, it's far more environmentally friendly than all that washing and drying and all that wastewater and things going into our lakes and streams. You use it for dry mopping, wet mopping, and cleaning all the surfaces. In a simulation study that we did with real pathogens, single use removed 78% of the pathogens, laundered microfiber only 14%, so dramatically more effective. Disinfectants, you know, NADCC, such as Defender, that's available now in US and Canada. It's a sporicidal disinfectant, has a biofilm claim. It's a great alternative to bleach, and it's safer on surfaces. You can use it on floors. It can be used in a single-use application, or like an Oxyvir, a single-use wipe where you pull out. That has a short contact time and is safe on surfaces. I will tell you there's dramatic shortages on a lot of products, so make sure you check your suppliers on in getting these into your facilities. Enhanced disinfection, whether it be UVC, misting, electrostatic, fogging. This is a great way to further reduce the bioburden on a surface. So if you look at the charts, after cleaning, when, you know, if you have 100% of the pathogens on surface, cleaning will remove about 50% of the pathogens. And the reason why we say 50 is because we know the study shows that a lot of the surface, over 50% of them, are mist. I'll show you that study in a minute. But, you know, unless they're wiping down every surface, every square inch, there's a great chance to miss something. By using these enhanced disinfections, you can reduce the amount of pathogens, in many cases, below 1%. You're giving your occupants a safer environment to get back into. So continuous disinfection, whether it be antimicrobial surfaces, oxidizing molecules, HVAC-based systems, or water-based systems. There's a lot of things and technologies that will actually quickly reduce continuously the amount of pathogen load. And this is really the next generation of cleaning and disinfection that everyone really needs to be looking at in your arsenal. So we're going to talk next about, you know, how do you assess the effectiveness and how do you measure the effectiveness of cleaning and disinfection? So let's talk about this. First, you need to do an environmental risk assessment. Assess the type of area that you're cleaning. You need to determine the labor and frequency that you're actually going to clean that space. And the type of space can be varied. Are we talking an office? Are we talking a classroom? Talking a patient room? Are we talking a school bus? Are we talking an OR? Understanding the type of space that you're in is critical to understanding how much labor and the frequency is needed. Based upon those two things, you need to develop procedural guidelines for each of those areas. You need to, once you've done that, you need to assess employee competence and the process compliance. So after you've determined the labor, you've trained your staff, you need to assess whether your staff are actually competent to complete those tasks and whether they're compliant on a regular basis to actually following the process. Those things will become the foundation of your process improvement and retraining plan. Training is critical. You cannot do it enough, and especially this environment. Classroom training is great, but you got to get hands-on training. You have to get up onto the floors or into the environment where your housekeepers are there. You need to observe after you've trained them, recorrect them and retrain them as needed, validate them through inspection process, and then start the process all over again. Especially as it comes to hand hygiene, PPE, and cleaning and disinfection, this is a continuous process and some of the biggest failure points. We train our housekeepers and cleaners and we send them up, and that validation process doesn't occur and the retraining doesn't occur. I can't emphasize this enough. So currently, the majority of training that we do in evaluation, so when we're actually evaluating whether something's clean or not, a lot of what we're doing is visual inspections. We go in a room, we look around and say, yeah, okay, that looks good. The challenge is in today's world, we know what we don't see can be deadly. And we need to change the way, we need to get away from this visual inspection process. It's still good, but we need to dig deeper. This is a study done by 50 facilities in the Boston area. It was actually 50 hospitals, Dr. Philip Carling. And they studied how, they put invisible markers throughout the building, and they studied what percentage of the surfaces were actually wiped. Amazingly, average after 50 buildings, only 49% of the surfaces were cleaned. And that's simply because housekeepers are visually cleaning. We're pushing them too fast. We're not giving them enough time. So that's something to absolutely keep in mind. A simple process is using some sort of black light inspection as a way to put invisible markers throughout the room. There's a lot of them on the market, but you can simply put these markers throughout the room prior to cleaning and use it as a non-punitive. You're teaching housekeepers, hey, you did a great job in your room, but you missed these 3 areas. See, the marker's still there, and you can use the black light to show what surfaces were actually not wiped. And it will drive effectiveness from the 50th percentile that we saw in the Carling study up over 90. It's the easiest, most cost-effective process to at least teach housekeepers how to wipe. The next step, and something that we need to look at in the future, and it is available right now, is biological testing. If we truly want to understand whether a surface has been biologically cleaned, we have to biologically test it. There's several companies out there that offer this as a testing guideline, and you get these swabs, you can mail them in. So this is something that we want to add to our repertoire, whether it's monthly, quarterly. Do it at least sometime to understand whether the products, the people, process, and technology that you're using in your environment is actually effective. Okay, I'm going to actually turn it over to Patty now, and she'll bring you through the next process.
Hello, everybody. Let me get it up here. Well, I'd like to thank everyone for from infection control tips for inviting GBAC and myself to present to you today, who GBAC is and what we're all about. So GBAC, the Global Biorisk Advisory Council, is a division of ISSA, and I joined ISSA last September, and prior to that, I was actually here in Atlanta, Georgia, with Emory University, as was described to you earlier. GBAC is all about prepare, respond, and recovery. That was our whole purpose of being put together, is that what we saw about 3 or 4 years ago was that if we brought together different disciplines, the disciplines of infection control, the disciplines of biosafety, biosecurity, professional disinfection, forensic restoration, the individuals who go and clean, sanitize, and disinfect spaces of hoarding or unsanitary conditions or crime scenes. We recognized in the cleaning industry, we recognized that, independently we had gaps, but together we actually could bring together more knowledge and expertise to solve some of the problems that we were seeing in our own little niches, in our own little silos, you might say. So when we joined ISSA and became a full division, we realized that we had a real need to be able to assist facilities, institutions, companies, and governments to actually prepare to pandemics. In January, I had talked to John Barrett about some programs that we wanted to look at, and we were going to be rolling them out in the fall of this year. And you're going to get a little preview of what's going to be coming up in the next week. Some of the programs that we're rolling out, just because we know that facilities and service providers are getting ready to open back up our economies and are really looking for some guidance. So ISSA, who are we really? Well, ISSA is a worldwide cleaning industry trade association. And so we represent the manufacturers of our disinfectants and of the equipment that John had indicated. Some of it is extremely innovative, cutting edge, artificial intelligence and robotics. And who would have thought, that we'd have these amazing, robots that go around and help us clean so that we can do other things. ISSA is in the world. We have currently about 93 member companies, not just members themselves, but member companies. GBAC, we have with advisory board representatives that have worked with Harvard, Penn State, myself with Emory, and several of us have worked with different governmental agencies and other associations. And we were, again, created specifically to deal with situations such as the pandemic that we are experiencing today, with, as it says here, absolute effectiveness and absolute integrity. These are just some of the different associations that we have, and some of the individuals. Who isn't on this? If you went out to our website, you can see our full board of directors, including Jeff Jones, who is one of our principal, and Mr. Clay Wardlaw, who decons the planes that brought folks back from Wuhan, China, and the Diamond Princess, and the planes that brought back states that had Ebola in 2014. We've represented and worked with multiple different groups, and from the ground up till running organizations, and with Dr. Paul Meachin there, who just retired from CDC and writing standards and guidelines. So these are real concerns, and interestingly, last fall I was asked to write a paper or an article for ISSA Today that was published in the January issue, and it was basically about pandemic preparedness, and we're not prepared. It came out the week that, really think everything became real here in the United States and the world about the pandemic. And so we're looking at is how we can, everything that we talked about and what John talked about earlier is cleaning for infectious diseases and how, and almost, not almost, it is a scalable response because we have, our routine things. And then as an outbreak or a pandemic starts to become real, and if we think about the flu season, you have routine cleaning. We have, routine cleaning plus maybe a disinfection step as the flu season starts. And then as we see it in our areas, in our buildings, to the point where, think about a K through 12 school, or where the absentee rates are to a point where they have to shut down the school and then have a more thorough cleaning and disinfection step happen. What are the best practices for limiting the impact? And people sometimes get frustrated, but the impact is not just on our health and our safety and our well-being, but it's also on our economies. And, so we get into, when pandemics do happen, that whole international health regulations and how we interact as countries together. We keep hearing we're all in this together, and we really are. So, one of the cornerstones of what GBAC started and was all about was training. And a lot of our training, I would say, that prior to the last couple of months was really, we refer to it as boutique type training. And that's that training that really is hands-on, face-to-face. We went through competencies, having people use some of this equipment that we're talking about. The donning and doffing, it's one of the things that's near and dear to my heart. Because during the 2014, with our serious communicable diseases unit at Emory, we made sure that any nurse or physician that was going into that space was going to have competency on being able to put on and take off their personal protective equipment. If they couldn't, weren't allowed to go in. And we had to shift within our healthcare groups the whole philosophy, because all they kept talking about was patient-centered care, and their perspective from their lens and how they looked at things, to more of a biosafety lens, looking at things from a provider. We had to shift it to provider-centered care, meaning that if we don't take care of our healthcare workers, then we won't have healthcare workers to take care of the patients, and come to an agreement on infection control and biosafety contamination control really meets the same goal, as far as we don't want anybody to become contaminated, the outside space, the patient, a research study, or the provider or the researcher. And so taking care of those individuals in the PPE donning and doffing was very important. But what we recognized in the last couple months, because we had several face-to-face sessions that were scheduled, we kept having to cancel them because travel was not available. And so what we did was we challenged ourselves to take the didactic part of the training and really put together the GBAC's Fundamentals Online course, or the Microbial Warrior Training is what we call it. Because we are all microbial warriors, even the kids, we need to teach them how to wash their hands right and not touch their face. And so we implemented, well, actually we launched this training about, I think it's 2 weeks ago now. And they have 30 days to complete it, to receive a certificate of completion from GBAC and ISSA. And GBAC, we've trained out, we have now about 11,000 individuals who, or spots that have been spoken for. And this training is for frontline individuals. We talk about all the different aspects that John talked about earlier: risk assessment, how to approach a site, how to select your equipment, how to select select your personal protective equipment, how to select your tools, your solutions, and bring things back, recover from a potential infect or contaminated site. The training, again, we go through multiple, even we talk about how you get sick. Now, as time goes on, this will transition to more of a generic infectious disease training with COVID-19 as an example. Right now, we're focusing very heavily on COVID-19 or SARS-CoV-2. We really want people to understand how to break the cycle or chain of infection. Again, and in the important aspect of cleaning, sanitization, and disinfection. So you're going to get a little bit of a preview to what's going to be coming out next week, and it's a GBAC Star. GBAC Star was a vision that myself and some members of our scientific advisory board had, and what we initially were looking at was the whole aspect of facilities, service providers, and GBAC and equipment and solutions that had been field tested. With the pandemic, we recognized, and as we started to approach the idea of coming back, of being able to open back up, we realized that facility needs were tremendous. And so we are launching our GBAC Star facility program this next week. So how does GBAC help organizations recover from the crisis? So we provide, the whole thought process was to provide confidence to our employees, to our to people's customers, as a third-party validation that the facilities are safe to reopen, that their work practices are in place, that the training that the individuals have had for being able to clean, sanitize, and disinfect are in place, and also the concept of infectious disease program prevention. If you think about it, as we start opening back up, the whole thought process of should we be wearing masks? Where do we need to have our alcohol hand sanitizing stations? How often should we be cleaning? How often should we be spraying with an electrostatic sprayer, and the solutions that we're utilizing? There's a lot, all the way from our healthcare organizations to our workout facilities, our salons, our restaurants. There is not, as John indicated earlier, there is not a business or organization that has not been affected by this. So what does it mean? I mean, again, to reiterate some things that we've been talking about, what we're looking at as somebody implements and puts in place of their programs going forward, they need proper procedures, they need proper training. We need to make sure that we have accurate chemistry and chemistry that's effective. And interestingly, when you think about the different disciplines, you need chemistry for all different types of situations, kitchens and restaurants, daycares. And if you're going to be if you're going to be spraying with an electrostatic sprayer, is it going to color fast the carpet or your draperies? So many different aspects involved with the programs going forward as we begin to open up. Proper tools, and then what type of personal protective equipment do we need to be wearing? And especially, as we all know, some of this personal protective equipment, some of the tools and some of the chemistries and the disinfectants that are available are really not available. And so how are we looking at alternatives? So who's it for? Again, there's that's not affected. Churches, spas, hotels, athletic clubs, daycares, again, stadiums and convention centers. Every single business out there who is desperately wanting to open back up is affected. And that's where we see GBAC Star and working with these organizations is important. So how does an organization become? And again, this will be launched this next week, where we can, where we'll start working with companies directly. And they have an initial registration. There will be a team member that will work with them and discuss how we can get facilities up and running. They complete the application. We begin doing an assessment, and it's like if you think about or LEED buildings or some of the green and sustainable programs that are out there. When you go into a hotel, you see the little card on the table that says, that they are sustainability, that's very important to them. This would be something that you would also see, a facility that had gone through GBAC Star and had met the requirements, that they would also be able to have that little card there that says we're a GBAC Star facility. Again, I just wanted to reiterate the Fundamentals online course. This is a self-paced course that people can go through. And again, they would receive the certificate of completion. And once we're able to get back together, we will still have our hands-on, because I get that asked all the time, the hands-on training and the other certifications that we offer. So I'm keeping it, I'm trying to keep it so that we're right on time. And thank you for the opportunity to introduce you to GBAC and GBAC programs and GBAC Star. Thank you.
Thank you, Patty. Thank you, John, as well, for this excellent and informative presentation. Patty, while I'm looking at some questions, if you don't mind checking your sound, you're breaking up a little bit, so that we can hear your responses to the questions.
Okay.
So we have several coming in, and I'll just start with this first one. I'm not sure which of you would like to answer this. There was a question about vacuuming as a pre-cleaning and the role of vacuuming. So John, you mentioned it a little bit about using a HEPA filter, but will you speak to that a little bit more?
Yeah, I mean, look, you have to know the risk associated with it. In the COVID world, the simple answer to the question, vacuuming is a great pre-cleaning process. But, we do recommend a HEPA filter in the vacuuming process to just keep a safer, better environment, so you're not just blowing the particulate around the room. If you're in a room that has a suspected person that's had COVID, I would not recommend vacuuming at that time.
Okay, thank you. Also, there was a question about apartment buildings. So how many times a week should the common area be cleaned, was the question.
Really, any area of any building, those high touch surfaces. So if you're an apartment building, the outer door, the elevator buttons, anything that people are touching, those common touched items, really should be done on a daily basis. And depending on frequency and how many people are coming in and out, you may want to increase your frequency. The more you can wipe down those surfaces, the better chance you have, because one person that coughs or sneezes into their hand that have COVID-19 and they touch one of those surfaces, the next person comes along, that transmission could occur. So it's better to at least get it done daily.
Okay. And I would think it probably depends on the product you're using and that type of thing as well. John, could you speak perhaps to dwell time? We have several questions in the chat and in the Q&A section. It just sounds like people are not really clear about dwell time, what it is, and if you could just speak to that.
Absolutely. So each disinfectant, when they're approved by the regulatory agency, lists how long the surface should stay wet. So typically you hear contact time, dwell time, wet time. They're really all synonymous. So it really speaks to how long the surface needs to stay wet for the disinfectant to be effective. So if on the label of the disinfectant it says a 10-minute contact time, then that's how long the surface needs to stay wet in order for that disinfectant to be effective. Now, the reality in today's world, or in any world, is surfaces usually dry in 4 to 5 minutes. So if you have a 10-minute disinfectant, you technically should be wiping that surface twice to keep it wet for that period of time so it can effectively kill the organisms that it was designed to do. That's why in today's world, we're moving to disinfectants that have at least a minimum of 4-minute contact time, because that's really realistically how long a surface will actually stay wet.
Okay.
Hopefully that answers it.
Let me just say, we also had a lot of questions about, are the webinars available? So they are all available on the Master Series website, TIPS Master Series website. There were several questions about how many times an N95 or other mask could be reworn, and that is a previous Master Series class as well that they can find. And there was a question about how do you measure clean? So that was also a previous master class. So those are some great questions, and rather than address those, I'm gonna refer those people asking those questions to the free recordings that are on the TIPS website. And there were some questions about our resources are available in French. And so if you go to the Canadian Public Health, you can get English or French. And then don't forget, May 5th will be only in French. So several things, lots of questions today, very good questions. There was a question about what percentage of alcohol needed to be in hand sanitizers. So I know from my own research, 60 to 90% alcohol concentration is typically recommended. Did either of you want to add anything to that?
Yeah, I mean, the Center for Disease Control in the U.S. recommends a minimum of 60% to be effective. So that's the minimum number that you want to have. And I think one of the questions was people that are, certainly there's some shortages in their organizations trying to create their own, but that's the minimum set by the CDC.
Okay. And then there were some questions that looks like we just maybe need to explain the difference between disinfection and sterilization. So Patty, are you back? Is your sound working? Do you want to address that?
Sure. So with disinfection, you're looking for what's called a 6-log kill. So it's 99.999, 4 more nines, 6 nines altogether, percent kill. Usually when you look at that, and there's actually charts that you can go to, that would leave a, one, let's say, bacteria left out of everything. It's nothing's ever really 100% until you start getting into the sanitization, or sterilization. With sterilization, you also are looking at spores. And so that is beyond that 99.9999% kill. And you're also trying to address spores. You see the sterilization in things like a lot of pharmaceutical companies. You'll see it in some areas within healthcare. And so it's just that next step. And we're not trying to make a sterile environment with what we're trying to do with bringing spaces, disinfected, for the COVID-19 in common spaces.
Okay. And John, let me ask you this. There was a question that talked about the benefit of disposable, like paper towels versus microfiber. So should we reuse a microfiber, or should we use a disposable paper product?
Yeah, it's a great question. One of the first things you want to look at is what is effective or what's compatible with the disinfectant that you're using. And that's a common mistake. As we saw that chart with quaternary ammoniums, when used with microfiber or cotton materials, they actually inactivated the disinfectant down to 0 parts per million. Certain paper towels and whatnot can have pulp that may affect also the effectiveness of the disinfectant. So it's something you want to talk to your supplier of your disinfectant to make sure you're using the most effective item. I always recommend the single use because, again, the microfiber in itself is mechanically, even without disinfectant, is a great tool in your arsenal to remove these pathogens from the surface. whereas, paper towels aren't going to be as effective. So, but the first step really is to check with your supplier of your disinfectant to see which process and product is compatible with that exact disinfectant.
Okay, then we had a question about, I know PPE has certainly been in the news for healthcare workers, but a question was, would you recommend PPE for hotel workers that perhaps are cleaning in the hotel environment?
Yes, this is Patty. I'm actually working with the hotel industry right now. And we are looking at what those guidelines are going to be. And so, it depends upon what you're doing, so the level of PPE. But then also, as we get back, some of the requirements are going to be social distancing and masks, to be able to get back starting in business again. Again, also, you got to remember, what are they actually doing? If it is a person who's going in there and disinfecting with an electrostatic sprayer, they're going to have a different personal protective need than the individual who's going in and changing the bedding or cleaning the bathroom. So I think what we're going to see is sort of like a tiered effect when we initially open back up, and you're going to see people wearing more masks to after, when things start to get relaxed a little bit as time goes on.
Okay, certainly. I think PPE has become a household word for most everybody. Here's a question that says, are there any recommendations for preventing just smearing while wiping a surface? What can we do to encapsulate microorganisms instead of cross-contaminating surfaces?
Well, I'll take a stab at that. As I talked about in my section, cleaning, then disinfecting is critical. Using a cleaner with a surfactant is going to help, create that, mechanical activity to get the gross soils. So when you use the actual disinfectant, you're going to have reduced amount or eliminate the smearing challenge. Also, using the single-use process versus a reusable is going to give you the biggest success to eliminate and reduce that also.
Yeah, I mean, that's absolutely to actually add on to that is that whole mechanism of how, like, if you're using a single-use microfiber towel and you fold it so that you have you don't want to crunch it up into your hand and then do that scrubby all over. You want to be able to do from one side to the other, and it's a systematic mechanical action of how you're cleaning a surface, as well as if you're folding that microfiber towel and you're able to reopen to a clean side. It's all of those actions help with that, not spreading the contamination. And in addition to, as John indicated, that last step of a terminal disinfection step is really important.
Okay, we've had a couple comments that make my heart real happy because they're about hand hygiene. So one was about fingernails and using a brush, and I just referred that person to the guidelines that your nails should be so short that if you look at them from the palm side, you should not see your nail from the other side. And then there's a question following up with that about hand dryers. And should we be using the electrical hand dryers that are blowing air? And there's just a lot of research to say paper towels would probably be better, but especially if you're in an environment where you're concerned about spreading an airborne pathogen. So those were not questions so much as comments from me. But here's a question. What about modifications to HVAC systems? Should there be any special filters, UV light, or anything special for your HVAC system in the COVID world?
Well, certainly it will be dependent on the type of environment that you're in. I've been working with a lot of the field hospitals or temporary hospitals that have been constructed throughout the country to to deal with the onslaught of number of patients, and we usually go to a negative pressure and then a HEPA filtration before it's exited. Other facilities can create a higher mix of fresh air. So it's really something that, you know, you got to work with your facilities team and your HVAC team. There are CDC and other guidelines on both filtration and, you know, there's other things such as UV in your ducts to help keep your ducts clean, and the continuous disinfection such as Casper that's creating a continuous disinfection throughout your facility and in your ducts. So, you know, those are things that you want to look at in your arsenal as you consider your whole environment.
Yeah, and this is actually a topic that we're researching right now, working with NADCA, the National Duct Cleaning Association of America. There are, you know, the UV light in the system. There's, you know, a lot of folks are thinking about, well, I'll just add in a UV light. You need to make sure that whoever is, if you're going to go down that road, you really need to make sure that the people who are going to be installing it are trained and certified to do so. The other thing is that there are other inherent hazards that come into play. If one breaks, some of these lights have mercury in them, and you've got to think about all of these things ahead of time before you just do it. We're finding that, you know, adding in filter systems into a existing building is not as easy as you might think. And, you know, the whole aspect, if you're increasing your airflow, as far as some of these like convention centers that had been turned into COVID-19, you know, field hospitals, you know, they wanted to increase the outside air. Well, that means that they have to then be, you know, conditioned air, and then the whole recirculating aspect of it. It's the HVAC situation is a very complex one, and so it's really, if you're going to be making modifications to your ventilation system, you really need to bring in an HVAC specialist to help you.
Okay, I'm going to comment on this question from Ken, was about the difference between SARS-CoV-2 and COVID-19. And I'll just say, when I graduated nursing school in '85, there was a new virus, and now we call it HIV. But so these are terms that it's a novel virus. So as we settle on a name, we've called it Wuhan, we've called it COVID-19, SARS-CoV-2. So it's just the same new novel virus with different names till we kind of settle on the name. So just know you'll be seeing different names for a while.
Actually, SARS-CoV-2 is the name of the virus. COVID-19 is the name of the disease, according to WHO.
So it's just emerging, so we'll have a while. But here's a question. I was happy to see this because in our last webinar, it kind of came up that we need to still be mindful and use common sense, and just remember not to mix products and not to microwave metal things. So here's one that's, which disinfectants are compatible with cleaning tools and mops? And so I know, John, you're going to say, check your manufacturer's guidelines. And perhaps you could talk about that, and also about the quats with a cotton mop. So John, what do you have to say about that?
Yeah, I mean, it's absolutely, quat binding is something that's been around for a long time. We showed that study from Dr. Boyce where, you know, quaternary ammoniums are used in your fabric softener. They attach to the fiber and they stay there. They make it soft and smell nice. The same happens, the same theory and principle happens when you're cleaning. You put your quaternary ammonium in the bucket. If you put mops and cloths in there, the quaternary ammonium disinfectant will attach itself to the cloth and will not release to allow the disinfectant to actually work. There's so many different products out there that it is hard to understand. You know, it's a very broad question, but, you know, I would really refer to your manufacturer to understand what exactly is the product that will work with what fabric, because there are a lot of fabrics that will create that binding effect and deactivate your disinfectant.
Very good. So I'm going to ask one more question. I appreciate everybody staying on the line. I know we've run a little over, but our panelists said they were willing. So thank you all for participating and for attending. But let me ask you this one, John. Do you have recommendations for disinfecting carpeted areas in large office environments?
It's a challenging situation because there's very few things that you can do to fully disinfect a carpet. You really need to look at the type of carpet, the type of backing, and there's very few things in the world that are actually going to fully disinfect it. So you're going to have to go to and there's literally thousands. I know this is not a great answer, but there's thousands of types of carpet material and backing. You need to understand specifically what they are, talk to the manufacturer rep to see, what would they recommend? Can you put various products on there without damaging the actual carpet itself? And, especially with the backing, that's going to add a significant challenge if you have a carpet backing and even have any ability to disinfect it.
All right, well, thank you. And thank you, John and Patty, for this excellent and very informative presentation. Let me just remind all participants, if we didn't get to your question, because we had so many today, we will answer those. So you will see a response to your question. And thank everyone for attending today. Remember to join us May 5th. See the masterseries.events for the details. And that will be the webinar that's offered in French only. So thank everybody today, and we will see you on May 5th.
Yeah, that was a tremendous.